Blood cancer is among the top 10 most common and lethal cancers in the world. For diagnosis confirmation and disease follow-up, patients' bone marrow is studied to evaluate blood cells maturation and differentiation status. Bone marrow biopsy specimens will be stained and evaluated under the microscope for morphology study. Biopsy specimens will also undergo another standard immunoprofiling clinical team called flow cytometry, in which the fluorophore-conjugated antibodies were used to identify and analyze cell surface antigens. Physicians will then analyze the antigen expression pattern to distinguish cancer cells from normal cells. In order to perform comprehensive assessment, more than 20 cell markers will be measured in one examination. Therefore, data generated from each exam is very complex. It requires physicians to analyze more than 100 plots for one test. Due to the complexity and the volume of the flow measurement data, it takes an experienced technologist or hematopathologist more than 30 minutes to complete interpretation for just one single test. Given the large exam surface volume per day and limited numbers of professionals in hospitals, lots of examination data were not able to be interpreted on the same day. Physicians have to wait, sometimes up to 2 weeks, to receive the flow interpretation report. Such delay leads to delay in treatment initiation and other clinical decisions for blood cancer patients. Patients with rapid progressing disease, they might miss their optimal therapeutic window for treatment because of the long waiting time. In countries with hematology specialist shortage, the problem is even worse. To solve this problem, a head team works alongside with clinical doctors to develop AI-assisted diagnostic tools using historical flow cytometry data and reports within the proprietary database. It's called the AHEAD Flow Triage Platform. It only takes on average 7 seconds for a AHEAD Flow Triage platform to identify specimens with cancer cells through fully automated flow cytometry data analysis. AHEAD Flow also utilizes a unique visualization method, allowing users to compare the sample in question with other historical flow data easily. With the AHEAD Flow blood cancer triage tool, doctors could identify abnormal cases sooner and prioritize their workflow accordingly, allowing flow report sign-off in 1 to 2 days. With a AHEAD Flow platform, we can reduce analysis report turnaround time, reduce the treatment delay, and increase service capacity. In areas with hematology specialist shortage, a AHEAD Flow Triage platform can help identify patients who need medical referral earlier and directly help to improve global blood cancer diagnosis quality and healthcare access. Our mission is to develop AI-enabled clinical decision support tools to support physicians in every step of blood cancer management.